Bismillahirrahmanirrahim. So after determination of axis, so let's talk about the abnormalities of P wave. So let me tell you first, what is the normal P wave. So it is like this. If we draw it like this, so its height is less than 2.5 small scale, that is equal to less than 2.5 millimeters, right? And its width is less than 2.5 small scales, that is equal to, it should be less than 110 milliseconds, right? So what if the height is increased? So if height is increased, right, if we have increased height, along with that we have the PR segment, then we'll have this QRS complex, right? So if height is more than 2.5 small scale, 2.5 small scales, and or more than 2.5 millimeters, right, in lead rhythm lead, that is lead 2, right? So if its height is more than 2.5, and along with that there is right axis deviation of P wave, right? So we're gonna say that this is called as the P pulmonale, right? So this is called as P pulmonale. So there is another condition, right, in which the height is more than 2.5 millimeters, but we find that the patient is the ECG is having left axis deviation, right, of P wave, right? So that is seen with P congenital, right? That means that the patient is having congenital heart disease, right? Okay, if we find that the height is more than 2.5 millimeters, right, and if we do the echo, and echo is normal, so there is no atrial involvement or there is no valvular pathology, so this condition is seen with the P pulmonale is seen with the electrolyte abnormality, that is called as hypokalemia, right? So this is seen with an electrolyte abnormality, that is called as hypokalemia. So we're going to call it as pseudo P pulmonale, right? So these are the three conditions we're going to see in the patients if the height is more than 2.5 small scales, right? Okay, so this can be P pulmonale, P congenital, or this can be pseudo P pulmonale. And if we talk about normal, there's normal morphology, that is biphasic P wave, right? That is, it is present in lead V1. And why it is so? It is because of the right atria depolarized. So right atria is anatomically present anteriorly, and left atria is present posteriorly. So we'll have lead V1 looking at this, right? So when there's depolarization of right atria, so we're going to find the positive wave in lead V1, and because the vector is following the lead V1, so we'll have positive deflection. When there's depolarization of this left atria, so we'll have the opposite vector, so we'll find negative P wave in lead V1. So this is a normal variation of P wave that is seen in lead V1. So I have talked about that when the height is more than 2.5 small scale, 2.5 small scales are 2.5 millimeters. So we'll have three differences of that. But when the width is more than 2.5 small scales, so let's talk about that. So if width is like that, so we'll have the lateral component, right, that is increased. We know that the first half of the P wave, that represents the right atrial depolarization, right, and the second half or the later half represents the left atrial depolarization, right? So if we see that the second part is more prominent than the first part, right? So and there's increased width of P wave, right? So it's more than 2.5 small scales, right? So we're gonna say that this, and along with that, if we see the left axis deviation, right, of P wave, so this condition is called as P mitral, right? So if we see a mirror image of this thing, right, if we see the first part is larger than the second part, right, and the width is more than 2.5 small scales, so this condition is called as p tricuspidale. And there are some rare conditions, right, in which we see the p wave in lead v1 if initial positive component is more than 1.5 1.5 mm, more than 1.5 millimeters, and the negative component is more than 1 millimeter, right. So this in lead v1 basically we're talking about that, so we're gonna call it as biatrial enlargement, right. So this type of p wave is seen with biatrial enlargement, right. All right, so let me enumerate the abnormalities what we have discussed up till now. So we have discussed about the p pulmonale, p congenital, right, pseudo p pulmonale, p mitral, and p tricuspidale, right, and biatrial enlargement. So let's talk about seventh abnormality here, right. What if we find inverted p waves? So let me talk about that. So if we find an inverted p wave in lead 2, 3 and AVF, right, so just like that. So if we find inverted p wave, the next thing we need to do is to check the PR interval, right. So this is the inverted p wave. So let me draw another inverted p wave. So it's like that. So we have to check the PR interval. So if we find that there is inverted p wave in lead 2, 3 inferior leads in 2, 3 and AVF, so we need to check the PR interval. If PR interval is prolonged, that is more than 120 milliseconds, right. We already know the basics that 1 small scale is equal to 40 milliseconds, right. So it is, if it is more than 3 small scales, we're going to call it as, and along with that we'll have inverted p wave. So this condition is called as low atrial rhythm, right. So this condition is called as low atrial rhythm, right, also known as coronary sinus rhythm, right. And this condition, when PR interval is short, less than 120 milliseconds, right, so we're going to call it as junctional rhythm, right. So this is called as AV junctional rhythm, right. So we have two differences of this thing when we find inverted p waves in inferior leads, right. So I think that's enough for today. So in the next video I'm gonna talk about following conditions. So if we find, what if we find negative p wave in lead 1, right. So what is atrial tachycardia, right, the second condition. First one, this second, third one will be atrial flutter. What if we don't find any p wave, right, so atrial fibrillation. So what is wandering atrial pacemaker, what will be ECG of that, right. So what kind of abnormality we're going to see in the p wave. And the sixth condition I'm going to talk about, that is MAT, multifocal atrial tachycardia, right. So in the second part I'm going to discuss the rest of abnormalities of p wave. So that's all for today.